Good afternoon, everyone. So lovely, perfect. Okay, can everyone hear me? Can I do like a quick mic check, please? Let's see if everybody can hear me. So if anyone can unmute themselves and just let me know if they can hear me, that'd be great.
Yeah, we
Yay,
can hear you.
perfect.
Yeah, I can hear you.
Yep, hear you fine.
Perfect, good stuff. Okay, good. Thank you so much for joining us onto today's webinar. My name is Saba. I'm one of the senior compliance consultant at Smart Dental Compliance and Training and Smart Health Compliance and Training. And today our webinar is all about how to prepare for a CQC inspection. So just a bit about Smart Dental. We've been up and running for 6 years. We provide compliance services to dental practices and healthcare clinics as well. We've got our fastest growing IOM software, which is all based online, and it has got compliance, CPD courses, HR management, stock management, lab management. Some of you are already our clients, so it's amazing to see you guys on this webinar today. Those of you who are not our clients, we will go through the webinar and we're more than happy to take down your detail to give you a demo of our all-in-one management system. So without further delays, I know it's lunchtime. I don't know what the weather is down your end, but from my window, it's beautiful, it's sunshine. So I'm really excited to do this webinar with a lovely, bright, sunny mood today with you guys. And these webinars are held every single month. So we cover different topics every month. Sometimes it's myself, sometimes it's my colleague, Victoria. So we go through compliance management. We also got some really exciting webinars coming out this year, guys. So I'm going to be doing a webinar with an employment lawyer called Zamir Nazarali, all about employment law. We're also going to be doing another one on a SCOT practice. So we've got lots of guest speakers on that one. That one's going to be one of our best one. So I'm really looking forward to it. We're working tirelessly on that webinar. And then we've got some events that I'm going to share with you guys that are coming up, which might be useful as well. So I hope you guys can see my screen. Victoria, can you just check if you can see my screen and give me a thumbs up? Okay, so I've got a thumbs up. So that means you guys can see my screen. I don't know what's going on today. So how to prepare for a CQC inspection. Let's go on to my first slide. So who is the CQC? Let's start off with that. A lot of the time, I know you guys know who the CQC are and what they do, but just a quick overall recap. CQC are independent regulatory bodies of health and adult social care within England. They make sure that health and social care services provide people with safe, effective, compassionate, high quality of care, and they encourage care services to improve. They monitor, inspect, and regulate services. Then they publish what they find. So they come out, they carry out inspections, and then they will publish to the whole of the world that what that service is all about, their performance rating, what the outcome of the report was, and was it a good service, was it a poor service, was it a service that needed improving. So they will talk all about the service within their reports. So CQC inspections, one of the things that the CQC are very good at doing, we all know, are the CQC inspections. So CQC inspections are a very important part of regulating health and social care providers within England. And while data, evidence, information, and feedback play a large part within the CQC role, physical inspections are key in observing care, both generally speaking and against people's record to ensure individual needs are being met. So one of the ways that they would assess a healthcare provider or a dental provider is by carrying out an inspection. So I'll go through the different type of inspections and currently what CQC are doing in terms of their inspection, how they're going about it, because there's always changes that they are implementing. And even this year in January, there was a huge change that they were going to implement. However, that's been delayed to April. Maybe it will get a bit more delayed, but at the moment that's what they're saying, that it has been delayed, but they have started working on it. So I will be sharing how they carry out their CQC inspection. So there are two types of CQC inspections. A lot of our clients or like potential clients ask us, Saba, what are the two types of inspections? Can the CQC just turn up to our practice and carry out an inspection? Or do they have to give us notice? How long is the notice for? How does it all work? So the two type of inspection, the first type is comprehensive. And as the name suggests, comprehensive inspection takes a thorough look at all areas of the service to ensure that care you are providing is safe, caring, effective, responsive to people's need, and well led. When it comes to comprehensive inspection, there's nothing set in stone with regards to the frequency of inspection. So some practices, so one of our client, believe it or not, had 3 inspections in 1 year, and 2 of them were unannounced and comprehensive inspection, and one of them was announced. So there is no frequency of the inspection. It all just depends on the CQC. It all depends on the circumstances. And I will tell you some of the circumstances on how you can get an inspection very, very quickly. So the frequency of inspection, whether or not you're given notice, and how big the visiting CQC inspection team is. These will largely depend on the type of service you are providing as well. The next type of inspection that the CQC will carry out is called the focus inspection. And as implied by the name, focused inspection takes a look at less of your service. Although they do follow a fairly similar process to comprehensive inspection, with the focus inspection, they exist for 2 reasons. So why is a focus inspection carried out? To look at a specific concern. So this concern may be flagged during a comprehensive inspection or a routine monitoring work, for example, and to follow up on any change in provider circumstances. So, for example, if you've been involved in an acquisition, a merger, or a takeover. Okay, so let's talk a bit about focus inspection, because focus inspections are quite daunting, to be honest. One of the reasons why is because you don't get much notice. Usually it's about 24 to 48 hours notice that you would get a focused inspection. Okay, so you don't get a lot of time to prepare within a focused inspection. And as you can see, the 2 reasons are someone maybe have flagged something up. So nowadays, as we all know, within the dental and the healthcare industry, it's very common that you might get a staff member and they might not be happy when they're leaving, or something might have happened, and when they leave, they've called the CQC and they've said, oh, this practice needs an inspection because they are lacking on X, Y, or Z. I personally had an experience with one of my clients at a practice. She had a TCO, and the TCO wasn't extremely happy when he left. And when he left, he called the CQC and said he was really concerned about the cross-infection techniques that were being practiced within the practice. And also, like, the dentist wasn't changing gloves and things like that. Now, personally, they're our clients, so I knew them really well. And then the CQC literally called for an inspection. Within 3 days, they came to the practice and inspected the practice. Obviously, everything was absolutely fine, and there was no, red points in terms of, cross-infection techniques. But for the practice owner, it was very daunting because, she was super, super busy, a fully booked diary, and she called me straight away. She said, Saba, I've got a CQC inspection. They've said it's a focus inspection. I don't know what has happened. So when I told her to explain, has a recent staff member left, or has a recent maybe patient complained and that complaint wasn't dealt with properly, we found out it could be one of those reasons why she was having the inspection. So being her compliance provider, we went on the day, we prepared her with everything, we looked at all her documentation. I done a hand hygiene audit just to make sure that she was changing the gloves and everything was all in place, and got her ready for the CQC inspection. So that's some of the things that we do, like within the company. If you do have an inspection coming up, or if you're not sure, or even if you're scared about the inspection, you can give us a call and we do come out and carry out a mock inspection as well. Also, to follow up any changes. So sometimes you might be going from a sole trader to a limited company, or from a limited company to a sole trader, or there might be a change of registered manager as well, or you're taking over a practice. So these are all the trigger points that a focus inspection can happen. So if it is any one of these, again, be ready to get a CQC inspection, because we do get a lot of clients and they said, oh, the ownership has changed now. So it was this person, now it's this person. Will we get an inspection? Yes, you would get an inspection, because there is a change within your, normal circumstances. So the CQC would want to have a look, what is this change? Why is this happening as well? Okay, so these are the 2 main reasons you can get a focused inspection from the CQC. So what does the CQC inspect, or how do they inspect, or what are the key lines of inquiry? You guys must have heard about all the key lines of inquiries. There's 5 key lines of inquiry that you need to be aware of, whether you're a dental provider or a healthcare provider or registered with the CQC. Number 1 is safe. So what the CQC would look at, are the services you guys providing safe? Are they effective? Are they caring? Are they responsive to people's need? Are they well led? And for each key line of inquiry, there's a lot of questions that the CQC would go through in order to assess your service. So for example, I've just put the main ones on this table. Under the safe, one of the very hot topics that the CQC look at, do you protect service users from abuse and any forms of avoidable harm? Now, this is referring to safeguarding. So safeguarding is a very hot topic when it comes to CQC. They want to know if you've got a safeguarding policy, if you've got if all staff have completed their safeguarding level 1 and 2 training. If you are a safeguarding lead, ideally safeguarding level 3 training would be really, really helpful as well. Or designated safeguarding lead training for safe. In order, safeguarding flowcharts are very important. How to distinguish if there was a safeguarding issue. So you've got the body maps as well. So ideally you should have a body map, so whoever is assessing any safeguarding issues, they can, you know, use the body map in order to do that. So there's lots of policies, audits, risk assessments, lots of protocols around safeguarding, flowcharts that you all need to be aware of, and the training part is one of the most important part. So you need to make sure that you have a good understanding of safeguarding level 1 and 2 as well. So that's for your safeguarding, which comes under safe. In effective, it says, does the care, treatment, and support you provide achieve good outcome, help maintain a good quality of life, and is it based on the possible evidence? Now, one of the things with key lines of inquiries that I don't really like, or it gets me confused sometimes, is a lot of the key lines of inquiry and the evidence that the CQC are looking for is overlapping. So with our portal in the IOM software, what we've done is we've created like folders. So you will have like practice policy folder, practice audit, risk assessment, log sheets. You'll have all different type of folders within, you know, the IOM system. And we don't do it according to the key lines of inquiry. Obviously, each folder is related to the key lines of inquiry, but that doesn't necessarily mean it comes under the key line of inquiry. So this is why some evidence are overlapping. So you just, if you've provided evidence for, let's say, safe, you might not need to provide that evidence for effective. Yeah, I hope that makes sense. Are you caring? Does your employee treat your service users with compassion, kindness, dignity, and respect? So making sure you are keeping up to date with your staff appraisals on an annual basis. So staff appraisal predominantly for employed staff is extremely important, as well as self-employed, but you can prioritize the employed staff, and carrying out yearly appraisals are very important. Recruitment checks. So sometimes we get confused. We're recruiting people. So one of the questions that I often get asked, if I've recruited a nurse, does she need to do a completely new DBS? Yes. So if she started working at your practice, she needs to do a new DBS, even though she had an old DBS with another practice. This is what I was told at a recent CQC inspection. So let's say I'm a dental nurse. I done my DBS 2 years ago. I'm starting a new job tomorrow. Now, the new job that I'm starting, I need to make sure I have an up-to-date DBS for that. Okay. So that is the question we get asked a lot. Another question we get asked a lot is, if a staff member has been working for 12 years, do they need a new DBS every 3 years? Now, there's a grey line to this. It's not really black and white. If they've done a DBS at the time of joining, and then after that, you can get them to sign a DBS declaration. Again, the forms are present on our IOM compliance software. So that declaration basically says that nothing has affected their DBS in the last year, so they're happy to sign it off. So basically, they're giving self-declaration that there has been no changes to their DBS recently. So those are the most frequently questions that we get asked under caring. Are you responsive to people's needs? So are the service organized in a way that meets the needs of other users? So making sure that you have got complaints flowchart, you've got complaints policy, your patients know how to make complaints, and your team knows how to deal with complaints. That's very important as well. Sometimes the team are not aware of how to handle complaints. So complaint handling is very important, and again is part of your mandatory training that all staff member need to do. Are you well led? So do you provide high quality leadership, management, governance that results in high quality care of all users? Do you encourage learning and innovation? And do you actively promote a fair and open culture? So again, your GDC standards, making sure you're putting your patient interest first, making sure that you're promoting a fair and open culture. If there's been any complaint, what have you done to put it, to rectify that complaint? There was a practice that I went to, and they had like a public notice board, and one of the things that I really liked about that practice is what they would do, they would put like, these are the suggestions that our patient has suggested, and this is what we've done to rectify it. Obviously not, a major complaint, but they would put like suggestions. So they had like complaint suggestions and different things where, patient would come up with, oh, it would be very nice if we had access to this, and then the practice would put it into place, a bit like having a wish list. And the practice would put it into place, and they would share it with the whole of their team and whole of their patients as well. So that was something that the CQC really liked about that practice during the inspection. Right, so these were the key lines of inquiry. Okay, so let's start off what happens. So the first thing, so if you were to get a CQC inspection, if it's a comprehensive inspection, you would get an email. So sometimes you would get a call. 90% of the time you would get a call actually, but if they haven't managed to get through to you, then you would get an email. So in the call, they would just say that, we're going to be coming out to inspect your practice. We'll send you the email with all the details. So the email goes something like this, and everybody calls it the first daunting email. We will be assessing your location on this following date. We're adapting and developing our methods in line with the 2021 strategy. So if you heard our previous webinar by Victoria, she talked about what the 2021 strategy is. Again, you can access that webinar on our YouTube channel and see what, she covered, what were the new strategies for the CQC key lines of inquiries. When we monitor, assess, and regulate dental practices, we want to make sure we look at things that matter to people who use them. During our assessment, we ask 5 key questions about the quality and safety of the service. So at the time of inspection, they wouldn't really ask, are you guys safe? Are you effective? As I said, each key line of inquiry would have more questions under them, and those are the questions that they would ask in order to assess if you are meeting the key lines of inquiries. You can read more about our approach to regulating and assessing primary dental services on our website. So they give you a whole email, and I mean, this is very short. I've just put like a bit of a introduction of the email, but one of the things within the email that they go through, they attach now. So this is like very recently. So in the last 10 inspections that I've been on, or the client has emailed us saying that we've got an email from the CQC. I'm going to actually go through that pre-assessment form because it's very important. Oh, okay, I put the wrong link on here. Don't worry about it. Just give me 2 seconds and I will get that done. So within the pre-assessment forms, sorry guys, I wouldn't be too long. Let me just go onto my Google Drive and get you those pre-assessment form. So within the pre-assessment form, they do ask you a lot of questions, and they do ask you to fill out a lot of paperwork as well. And it's very important. Pre-assessment form, pre-assessment information template. Let's see, I think it's this one. Okay, so just opening now. So within the pre-assessment information template, the CQC, here it is. So let me just make sure you guys can see my pre-assessment form properly. So let's have a look. Yay, perfect. So you can see my pre-assessment form. So let's have a look at this pre-assessment form because it's really important that we do fill this form out accurately. A lot of dental and healthcare providers get this form. I mean, most of the practices nowadays, this is what the CQC are doing. And I think this is their new approach to the 2021 strategy, because what they want to do is they want to collate as much information as possible before the inspection. So when they're coming out, they're not spending a lot of time in practice. So it's very important, whatever they've asked for in that email, that you do send it to them, okay? So location name. So obviously what you could do is, I'm just going to use a generic one, Smile Dental Care. Location ID. So this is your CQC ID. So when you first get registered by the CQC, they provide you with the ID. So within the location ID, you need to put that down. So for example, 1255789. So you can find that in the original certificate. So if you've got original certificate from the CQC saying that you've been registered, you will find the location ID on there. Okay. Name of the registered manager or provider. So whoever the registered manager was at the time of opening the inspection. So a lot of people get confused and they put the practice manager's name. If your practice manager is a registered provider with the CQC, that's fine. If they're not a registered provider with the CQC, please do not add their information because they're not. Okay. And then we go to contact name and details. So who would be please insert the name of the person who's filling out the form. So again, if it's the registered manager filling out the form, they can put their details. But if it's the practice manager filling out the form, you put the detail. Opening hours. So what are your opening hours and days? So for example, Monday, 9 a.m. to 5 p.m. Okay. And if you do have lunch, you can say closed for lunch from 1 p.m. to 2 p.m. Okay. So you can do that on here. So I'm just giving you guys an example, but you have to fill it out according to your own practice details. Then we scroll down, and this is about the staffing and the service. So what type of service are you providing? Number of dental chairs. So for example, 3 chairs. Okay. Is it a corporate? So you're a dental corporate. Have you got multiple practices? Yes or no? So no, we are an individual practice. Is it NHS, private, mixed, total UDAs allocated if providing NHS? So if you're totally private, NHS, again, very self-explanatory. What are your total UDAs? So we've only got 1,000 UDAs, very small contract, and we're a mixed practice, okay? Are you a referral practice? So do you refer patients out, or are patients being referred to you guys? So you can fill that out. Is it individual, partnership, or organization? Now, again, within our upcoming webinars, we will be talking about submitting CQC application forms and or registering with the CQC. So if you do want to know the difference between individual, partnership, and organization, then you can jump on our upcoming webinars and see what the differences are. 90% of the time, dental practices or healthcare providers are an organization because they're a limited company. So organization refers to that, or sometimes it's a partnership. So in the limited company, if there's 2 partners who's got 50% share, then again, it will be partnership. And individual basically refers to sole traders. Okay. Number of CQC registration at this address. So do you have more than one CQC registration at this address, or is it just one? Again, 99% of the time it's only one. What we mean by more, so for example, let's say I've got a medical center and I have got 2 let's say GP rooms or consultation rooms which are related to medical, and I've got 2 which are related to dental and 2 which are related to maybe aesthetics. So then I might have multiple CQC registrations because I'll have a different registration for the dental, and I might have a different, especially if there's 2 different partners running the 2 different services. Okay. But if you're only one service like a dental practice, then it's really, really simple. It's one registration. Then we move on to the staffing numbers. So they want to know, again, you can fill this out, how many specialists you have, how many dentists you have. So specialists, for example, I've got 1, I've got 2 dentists, qualified dental nurses, I've got 1, trainee dental nurses, I've got 2, reception staff, I've got 2, 1 manager. Okay, so I've got 1 manager. Support staff, so maybe like admin staff or like TCOs and things like that. Visiting staff, so visiting staff, again, if you've got, let's say if you do sedation and you've got sedation, that who a sedationist who comes and visits, then you can put their details on there as well. Okay. Then we move on. What specialism service that you offer? Are you an in-house sedationist? So do you provide the sedation service, foundation training, orthodontist, domiciliary, dental implants, endodontic, oral surgery? So again, very self-explanatory. Extended duties. Are there any staff members who have extended duties within the practice? So for example, is anybody radiography trained or fluoride application or impression taking? So that is predominantly referring to your dental nurses. Okay. Lead roles. So safeguarding lead. So who's a safeguarding lead? So that could be myself. Legionella lead. Again, it's not mandatory to have Legionella lead, or if you've got an infection control lead, they can also be a Legionella lead. Okay. So I'm just going to put our lovely Victoria here, who's our Legionella lead, as well as our cross-infection lead. Complaints manager, so who handles the complaints 90% of the time is the practice manager, so you can put the practice manager name. In others, you can also add DPO, so if you've got a data protection officer, you can add their details on there as well if you wanted to. So that's on here. Then we move on to the equipment of the practice. So what equipment does the practice have? How many units? So intraoral units. So for example, intraoral units. Yes, I've got intraoral units and I've got 2. Handheld X-ray machines. Yes, I might have 1 of handheld X-ray machines. So that's CBCT. So again, if you've got CBCT, laser, OPG, you could do that. Closed circuit television. Do you have CCTV? Yes or no? Do you have a washer disinfector? Do you have an ultrasonic bath? And what are the number of autoclaves? Again, self-explanatory. Then we go to, do you dispense any medication? So do you give out antibiotics? Because obviously there's a whole protocol that you guys need to be aware of when it comes to antibiotics. Again, it's all on our IOM system. We've got antibiotics audits, we've got antibiotic logs on there as well, we've got a policy of medicine dispensing. So again, if you needed access to that, you can get that from the IOM software. Then we move on to the supporting information. So within the supporting information, they would like to see a copy of the statement of purpose. So statement of purpose is what services you would be providing at your practice. And this is usually submitted at the time of submitting CQC application. So that's what you need to attach. Now, 50% of the time, sometimes my client do go, Saba, it was ages ago. It was like 12 years ago. I don't even remember if I done a statement of purpose or not. Not a problem at all. Again, if you're our clients, you will have a copy of statement of purpose under our compliance template. You can download it, you can fill it. It's really easy, guys. It's not a rocket science. It's super easy. It's just the name of your service, the addresses of your service, what service you're providing, and within each service type, what are the treatments that you would be providing. CQC website also has a template copy of statement of purpose, so you can always download that and fill that up as well if you're not sure. Okay. How do you ensure your recruitment policy is followed in lines? So if you have a spreadsheet, so again, with your within your recruitment policy, you should state what are the documents that you ask your staff member to submit at the time of recruiting them. So they've attached this spreadsheet that you can have access to. And again, you can fill this out for each of the staff member. So what are their names? What are their role? When did they start? Have you got all of these details for them? So the good news is, if you are our IOM member, you can run this report from our system. So let me show you. So this is our system. Let me just make sure I'm sharing the screen. Yep. So this is our software. And if I go to, on my left-hand side, reports, we've actually embedded that report on there. So typical, asking me to log back in. Okay. Right, so when I log into the IOM system, I haven't changed the password, guys, trust me. Okay, it's logging me in now. So when I log into the IOM system, on the left-hand side, we've got a tab that says reports. And under the reports, we've got HR management reports. If you click on that, there's another report called recruitment report, okay? And that report is pin protected, because it's got staff personal data in on there. So here's the report. So my one, you can see it's really red because this is just a demo account. You can download this report as an Excel, okay? And you can send this to the CQC. So you can download it, so you wouldn't have to do this. It's exactly the same. So you know the one I showed you over here, this one, and the one that we are downloading from the IOM software is exactly the same. And this is why it's really, really important. Those of you who are our clients, it's extremely important that you guys keep your staff HR files up to date, because if you would, and if you were to get an inspection, you've got it all on the system. You don't have to worry about it. You don't have to stress about it and get things prepared, because it's all there for you. All right. So we'll go back to our form again. The next one is, how do you have an oversight of staff CPDs? So again, you can put a comment in there that all our staff members have access to the IOM system where they complete their CPDs and they upload the certificates onto their personal profile. So now if I go back and I go to the CPD courses. If any of your staff member are doing CPD courses, they have this option where they can upload their CPD certificate directly onto their staff files. Okay, so for example, health and safety, if I click on this, now this will directly automatically go under the health and safety file under my profile. Okay, and then what you as a manager could do, again, go to reports, and then you can run a CPD go back to HR management report and run a training report. And this report, again, you can download it as Excel, is exactly the same report as the CQC are asking for on here. Okay. Our main purpose with the IOM system is to make sure whatever the CQC asks is all embedded on the system. So as long as you guys are updating the system, it's literally 2 clicks, download and send it all off to them. All right. The next thing it says, please list which audits you complete. Again, guys, you could very easily do that. So if I go back on here and I go to my activity calendar, if I'm using the IOM system, on my activity calendar at the bottom, okay, if I go to, for example, overdue, and there's a tab that says practice audits. So these are my practice audits: hand hygiene, sedation, prescribing drugs, disability, rubber dam, radiography. I can copy and paste all of these, so I can write all of these audits, even the ones that I've completed. If I go to practice audit, here's my cross infection one. Okay, so these are all the audits. If you've got the IOM system, these are all the audits that you can put down on your reports over here. So cross infection, hand hygiene. And what would be nice, again, the dates that they were last completed. You can get all this information from here. So the date that was last completed, 1st of January 2019. All right. So it tells you 11th of January 2023. So it tells you which date that you completed the audit as well. So again, you can populate all that information on here. Any learning points, how are these learning points shared within the practice? So when I complete an audit, if I have a look at my audit now, at the bottom of my audit, I've got a comment box and an action plan box. So if you've added any action plans, again, you can copy those action plans and put it onto this sheet over here for the CQC. If there's no action points, just write no action points, no learning points. But if there is, they would like to see that. That'd be really good. How do you ensure all your equipment is maintained and serviced regularly? So what's one of the things that we do with our equipment? We have our annual service for all our equipment. So you can put that in there. You do your equipment inventory as well, and you will do your visual equipment logs. So you can talk about that. Again, all present on the IOM system. Is there a fire risk assessment? So fire risk assessment, guys, the amount of times I tell my clients, fire risk assessment need to be carried out externally by a competent person. If you do it in-house, the person has to go on a 5 days fire training course, and there's nobody that goes on that. So annually by an external person. Is there fire risk assessment? Yes. When was it completed? Any action points? So again, if you look at your fire risk assessment reports, definitely at the last page, there will be some action points. Very rare do I come across a report where there's no action points. So you can talk about that. Is there a Legionella risk assessment in place? Again, you need to talk about the Legionella risk assessment from here. Summary of any accidents that have occurred within the last 12 months. So if you are our client, again, what we have got on the system, we have got, if we go on reports, and if we go to report and issue, under report and issue, report accidents and incidents. So if you have been logging all your accidents and incidents onto the IOM system, you can actually view them. So here's all my logs. And again, I can very quickly download the data. And if you don't even want to put it on the form, you can attach all the reports with this form when you're sending it out to the CQC. How cool is that, guys? Seriously, that would just save me so much time. Similarly, any complaints in the last 12 months, we've got that reporting functionality on the software as well. So again, if I go back to my reports and I go to complaints, I can have access to that as well. So report a complaint. So any complaints that have been reported on the system, I'll go to view. I can download them and attach them with this form if I don't want to add all the details. Because sometimes some complaints can be very long, and typing it all up and copying and pasting can be long. So you can just write on here, please see attached the summary of all our complaints for the last 12 months. Summary of patient feedback, which is gathered at practice. So what you can do, you can put some Google reviews on there. So if you guys are a Google registered business, just stick some Google reviews on there so they can have a look. Tell us about what you do well and what you're doing to improve the areas that presenting you with certain challenges. So this is the question I get asked all the time from my clients. What are we doing well? 100% every practice, there's some things that they do really, really well, whether it's patient care, whether it's dealing with complaints effectively, whether it's staff training or team training, you can add that all there. Areas of improvement, there's always areas of improvement, guys. There's always something that you could do to make your service better. So again, you can add that over here. Summary of any barriers for patient to receive treatments. So again, this was, this is relating to the fact that are you still seeing new patients, or have you stopped seeing new patient because you don't have any capacity anymore? So you can talk about that, which also leads very nicely to our next question. Are you expecting new patients or emergency patients? Again, doesn't have to be a long answer. You can say yes and no. Okay, so this is the initial form that you guys need to fill out, and I suggest that you fill it out as much as you can with a lot of information, okay, that you can provide. Again, use the IOM system. If you are our member, use the system to make sure that you are, using the system and providing that information to make your life easy. Then we move down, and this says having all the information listed would automatically make you compliant, designed to support you on the assessment day. So what they want you to do is get all of these things ready. Guys, again, I know I keep on saying this, but when I help practices prepare for CQC inspection and they've got our compliance system, we utilize the whole of our compliance system to pull all this information. So as you could see, they're talking about practice audits over here. They're talking about risk assessments. They're talking about policies. So let me go back to IOM, and on the IOM, there's a folder called My Upload. So within the My Upload, you've got different folders. So you've got practice policy folder, for example, and if I click on my practice policies, and for example, if I go to my COSH policy and I go to view, I can save this policy and send it off to the CQC. Now, at the moment, currently, we are working on a way where you can directly send this policy to an email address, okay? And that can be the CQC's email address, or you can send this whole folder to the CQC directly. So instead of downloading one, you just press a button and the whole folder will get sent off to the CQC before the inspection. So this is a new feature that is coming out on the IOM platform. Because we're constantly working on it to improve it and to make everybody's life a lot more easier. So all of these things that are listed on here, all the documents that the CQC want, can be sent before their inspection through the IOM software. And as I said, do try to send as much information as you can, whatever you have. And if you send it digitally, that's the best way. If you guys are still using the manual folders, you can see that you'll have to scan all of these documents to send it to them. This is why back in January, the CQC wanted every single person to try to go digital as much as they can, because they want more and more information to be emailed to them. Okay. Guys, if you do have any questions, please feel free to put it in the chat box, and Victoria will answer all those questions for you. And if it's a very pressing question and you want to ask, that's fine. I will give you a chance at the end to ask those questions as well. So, as I said, this is the pre-assessment information form. As you can see, it's quite lengthy. So you do need to block off at least like a day or two within your diary to make sure that you can work on this, like switch everything off, just solely work on this, get it all ready, send it off to the CQC. Ideally, if you've had a 2 weeks notice, you should send this to them 5 days in advance or 7 days in advance, so that they can go through all your documents and read them as well. Okay. Another tip I would like to give you, because I had problem with this, when you are sending them information, to send all these documents via attachments on an email, it's not going to attach because the file is too big. So use an external thing like WeTransfer, or maybe upload it on a Google Drive. Or if you've got the IOM system, we're soon going to have that feature, so you can send it through that as well. So yeah, just be aware of that. So Let's go back to our slide. I've gone through the pre-assessment form with you in a lot of detail, so I hope you're a bit more confident on how to fill that form out, get it all ready. And you know what you could do? And I know we get really, really busy and you say, yes, how about it's easy said then done, but we can like go through this form once a year or once every 6 months and just make sure we have all those things in place so you're always ready for that upcoming CQC inspection. Okay. So, things you can do to prepare. It would be helpful if you can return the attachments of the pre-assessment forms via email as soon as possible prior to the visit. You will also find a list of all the documents. Recruitment records of all clinical and administration staff should be sent. Please make yourself aware of this requirement. And again, what they've done in that email, they've sent you a lot of links so you can read up on like Health and Social Care Act. And please make sure you do read up on these guidance and acts because they can ask you questions about those as well. All staff, dental hygienists, visiting clinicians, agencies, dentist training certificate will need to be available for examination too. With regards to the agency staff, access to computer records will be fine. So sometimes we get a lot of locums, so make sure you can still put your locum on the IOM system, and especially if they're a regular locum, and you can upload all their certificates, or you can upload them all under my uploads as well. So remember to send as much information as possible to the CQC pre-inspection. Okay, this is my golden tip that I would like. If you don't take anything away from today's webinar, just take this one tip away. Okay, so make sure you send them as much information as you can to, so that they've got everything in place. And this will help to reduce your inspection time. I have been at practices where they've been there for 7 hours, like literally from 9 till 5. And I've been in practices where they've been there for 2 to 3 hours, just because that practice has done a bit of that preparation and got everything sent to them. Okay. Preparing for an inspection, use the key lines of inquiry as a guideline. CQC inspectors will gather evidence on the service. Speak to your employees. Now, one of the things with CQC inspections that I find, like, everybody gets really nervous and staff want to try to call in sick and leave it all for the practice manager or owners to deal with. It's not that daunting, guys. Don't worry about it. It'll be absolutely fine. Especially like if you're a dental nurse or dental receptionist, they would want to speak to you, just ask you some very basic, simple questions. So please make sure, like, again, one of the things that they do ask dental nurses is to run through a decontamination process. So make sure all your nurses know how to, run through a decontamination process properly, like, wearing their PPE. They know about manual cleaning. If you've got ultrasonic, they know about ultrasonic washer disinfectors and autoclaves as well. Okay. Listening to what people who use your service say. This can be done in a number of ways, including but not limited to speaking to people on individual or group levels, reading feedback left on comment notes, and gathering information for service user complaints and concerns, using various inspection methods like observing care, looking at individual care paths, reviewing records, looking at policy. So these are some of the things that they would look at on the day. Do a walkthrough of your practice. So one of the things that we forget, we're so busy compiling audits, risk assessment, logs, everything else, we forget to do a walkthrough of our practice. And this is very, very important because you can have all the compliance paperwork in the world and your practice could be dusty and it could be not clean or really cluttered, and they would just need that excuse to flag every single thing up and start going really, really deep. So please get a professional cleaner to come in one day before and clean the toilets, clean the reception area, the surgeries. Make sure your surgeries are clutter free. Don't leave everything out. Like some practices, they leave all the PPE out, all the instruments are out, the red boxes are there, and the boxes are stacked up. All that kind of stuff. Please, for the day, make sure you declutter and tidy the whole practice. Health and safety, identify where controlled drugs are kept and carry out a risk assessment of the potential hazards. Ensure fire equipment is in the right place and in date. So for example, your fire extinguishers, make sure they are in date. Okay, you've had a fire extinguisher service. Again, if you've got our platinum compliance package, that is some of the things that we do. We do your fire extinguishers and pat testing as well, fire risk assessment, Legionella risk assessment. Ensure fire exits are free and easily accessible. The correct signages are present. So fire escape routes. Sometimes the practice has a fire door at the back and it's just piled up with boxes of stock. That's a hazard. You need to make sure that your fire exits are clear. There's nothing hazard in between them. Have a first aid box in a recognized area. So first aid box and things like that, don't store it in the basement. Don't store it where people can't see. Store it near the reception area, because anybody can get a needle stick injury, or a patient is sitting in the waiting area, something can happen to them. So make sure your first aid kit, medical emergency drugs, oxygen, defibrillator is easily accessible and not stored somewhere on the 5th floor in the storeroom or somewhere like that. Okay. Stock control, very important. Remove all clinical and non-clinical out-of-date stock and materials. The amount of time I go into practices to do a mock inspection and I find expired stock, it's crazy. Anything expired, please get rid of it, okay? Make sure you actually get rid of it and not put it in a bag and put it somewhere behind the cupboard or hide it somewhere for the day, okay? Ensure the practice has good stock control system. So again, make sure that you're fully stocked, you're not running out of stock, or your stock is not out of stock, stock rotation is taking place, because these are some of the things that they do flag up very easily, okay? Whether it's a healthcare provider or whether it's a dental provider. Right. Carrying out a mock inspection. So my last golden tip is do a mock inspection. So I have already told you, you can use the pre-assessment form once a year to, do your checks to make sure everything is all in order. Alternatively, if you are a member of our compliance software, we have got a reporting feature. So if we go on to reports again, and under our reports, we've got mock inspection. So if we go to my mock inspections, you can carry out a full mock inspection of your practice, and we update our mock inspection forms on an annual basis with any new questions. So you can see it's already pre-filled from here, and then we've got all the questions over here. So for example, have you done a record keeping audit in the last 6 months? Yes, attach the audit. Now you will see that these questions over here, they are very, very similar to the questions that are being asked on those pre-assessment form, which has disappeared somewhere. Yeah, the pre-assessment form that I was going through with you guys, those questions are very similar to these questions, okay? So whether you do the pre-assessment or whether you run through this form over here, the mock inspection tool on the ION platform is exactly the same, okay? So you don't need to worry about it. So practice makes it perfect. Yes, as they all say, I remember when I was doing my GCSEs, the more papers, the past papers that I've done, the more easy I was, able to pass, and I felt more and more confident. So make sure you do like regular mock inspection just to ensure that you are up to date. Sometimes you might not know some questions and you might need somebody externally to come out to do mock inspection. We're here to do that for you. If you ever needed to book a mock inspection with us, you can do as well. So that's about the mock inspection. So my top tips from today's webinar are: ensure your policies are customized to your practice specification. Ensure all actions are actioned from your risk assessments. Very important. We get the risk assessment done and then we never bother reading it. We just scan it and upload it. And trust me, CQC will read every single word of that risk assessment report. So please make sure you read your action plans at least on your risk assessment and you're aware of them. Ensure the site is clean and tidy. Ensure the site has appropriate signages in place. Ensure all staff are confident in answering questions. Have patient feedback forms ready. Delegate tasks and have everything in a digital format. I can't emphasize enough how important it is to have digital copies of everything, whether that's your policies, whether that's your audits, your risk assessment. Please try to go as much digital as you can. It will make your life easy. It would make the CQC's life easy, everybody's life easy. Okay. And that was it. That was all about how to prepare for a CQC inspection. So this webinar was brought to you by Smart Dental Compliance and Training, one of the fastest growing compliance software. Our mission statement is: if you hate managing compliance, leave it all up to us. We'll help you to manage your compliance. At Smart Dental Compliance, we provide a user-friendly, streamlined, automated system that gives you prompts of all the audits, risk assessments, logs that you guys need to do. It's a very interactive dashboard. So I showed you how we all work, and we're very different to other compliance providers. The reason why is because we take control of compliance as an overall. So we're giving you CPD, we're giving you HR, rota scheduling, stock management under all one platform. We are going to be doing a quick webinar on our lab management as well that has come out a few weeks ago, and it's going really, really well. It's replacing all the lab books that are out there. We also have an app which you guys can download on your iPad or on your mobile phone, so you can access all your digital audits and risk assessments through there. We provide a very competitive pricing and 5-star customer service. These are some of our clients. And last but not least, what I want to quickly run through with you guys is the 3 different type of packages or services that we provide. So the software, the IOM software, all-in-one management, which has compliance, CPD, HR, lab management, on-site training, mock inspection, compliance check and call, and comprehensive employment advice, and an intensive reporting tool. So you saw how much I used the reporting tool today. That is at £99 plus VAT. If you don't have time to manage your compliance and you're really, really struggling and you need somebody to come in, do all your audits, you can opt for our Smart Consult package, which is 179 plus VAT, and you get the additional 4 consultancy days from us, and a qualified compliance consultant will come in and do all your audits, do your HR files, update all your policies. And our last package is the Platinum Compliance Package, which is 299 plus VAT, and that includes all your risk assessments, PVI, PAT testing, medical emergency training, in-house cross-infection training. We also offer RPA service, mock inspection, on-site training, again, comprehensive employment advice. We're working with Zamir Nazarali for Simplify EZR to give you really good employment advice on staff files and things like that. So these are our 3 main packages. We are exhibiting at the Dentistry Show at London Excel this weekend, which is Friday and Saturday. And our stand is, what's our stand again? C61. Thank you, Beta, for that. So we are going to be at C61 on Friday and Saturday. So if you want to come and see us, talk to us about our packages, we're doing lots of amazing stuff, guys. Those of you who haven't signed up, those of you who are our clients, we've got some exciting news to share with you guys as well at the Dentistry Show. We'll have our lovely goodie bags as well, which everybody loves, with lots of sweets and candies and all the nice things. And also look at our website. We've got lovely events coming up. We're doing a 1-day event of all the CPD courses. So if you have missed any of your CPDs, or if you need to catch up on your CPD cycle, we've got a 1-day CPD event coming up at the end of April, where we're going to be covering cross-infection, medical emergency, ILS training. Yes, ILS. So if your practice offers sedation, we've got a qualified ILS trainer who would be giving ILS training, and safeguarding level 1 and 2. So it's a 1-day, very nice, interactive, fun CPD event for those of you who are still lacking your annual CPD and want to join us. So that would be end of April. I believe it's 29th of April, but we will share it all out to all our clients or potential clients who would want to register for that event as well. So that was an overall from my end, what's happening in the world of smart compliance, and just some quick tips about any upcoming CQC inspections. As I mentioned, if you need any help, any advice, on our website, we've got free resources page. Feel free to download our free resources. If you have any questions, give us a call on 0800. You want to book a demo, please drop your email address or give us a call or an email, and we'll book a demo for you. If you have got our system and you wasn't sure about some of the features that I showed you guys, book a training session with us and we'll be more than happy to go through that with you as well. And that's all about it from my end. So I know Victoria is answering some of the questions that you guys are asking, which is great. Thank you, Victoria, for doing that. But I hope you guys enjoyed the webinar today and you learned something. Give us a thumbs up if you did enjoy the webinar, if you would like to see more, and if you'll be at the show. And if you have any questions, as I said, always feel free to email us. But thank you so much, guys, for joining us today at your lunchtime. And I hope you have a very good remaining week. Bye, everyone.